Step 2. The full assessment. The CCG will choose someone to coordinate the full assessment so that you have a named person to check things with. The full assessment has two parts: an assessment of your care needs and the decision support tool. The care needs assessment must give accurate and up-to-date information about your health and social care needs. This information should come from you and your family and a multidisciplinary team involved in your care. A multidisciplinary team is a group of 2 or more professionals who are different types of health and social care workers, like psychiatrists, nurses, social workers, care managers, occupational therapists, and so on, who work together. The multidisciplinary team uses all of the information from your care needs assessment to complete the decision support tool. The finished decision support tool helps the CCG decide if you should get CHC or not. The decision support tool has 12 sections called domains. Each domain helps you think about a different care need and consider the sort of support and how much support is needed to manage it. The domains are: 1. Behavior. This is about the way you behave, like being aggressive or noisy, or being frustrated because you have difficulty communicating with others. Some behavior is difficult for others to cope with, which is called challenging behavior, or some behaviors could be a risk to you or other people or things and will need special support and care. 2. Cognition. This is to do with brain skills like memory, understanding risks, decision-making, understanding where you are, and road safety. This affects the type of support you need to manage your day-to-day life and stay safe from harm. 3. Psychological and emotional needs. This is about your mental and emotional health, including things like mood disturbances, hallucinations, or anxiety. It's also about the effects of these, like when people have depression, they may get very withdrawn and refuse to accept help from others, which makes it harder for them to get better. 4. Communication. This is about whether you can express your needs and understand others in ways like talking or signing, use of pictures or braille, hearing aids, or other communication technology. 5. Mobility. This is to do with how well you can move and control your body and if you can stand or walk. It's important to think about your safety and if you are at risk of falling and need support. 6. Nutrition. This is about whether you can eat and drink, and if you need help with this, like feeding by peg, or if you have problems swallowing, like dysphagia. 7. Continence. This is about your needs with using the loo, like whether you can control this, or if you need help with things like managing constipation, catheters, urinary tract infections, and so on. 8. Skin. This is about looking after your skin. Some people are more at risk because they have a skin condition which can break their skin down, or they may have pressure damage or wounds that take a long time to heal. 9. Breathing. This is about your needs with any breathing difficulties you may have, like breathlessness, asthma, or chronic obstructive pulmonary disease. 10. Drug therapies and medication. This is about your experience of your symptoms and the medication you need. This could mean things like coping with pain, insulin injections, any side effects, or if you need prompting and supervision with medication. 11. Altered states of consciousness. This is about the conditions that affect consciousness, like having epilepsy or transient ischemic attacks, TIAs, which are like mini-strokes. Section 12 is for other significant care needs that are not described in the other domains if the care needs are really important for you. The order in which you think about the domains doesn't matter, as long as you think about other significant care needs last. Workers from the multidisciplinary team write about your care needs for each domain. They also measure your needs with these weightings: no needs, low, moderate, high, and for some domains, severe or priority. The domains and weightings are shown in a chart called a matrix. This can give a good picture of all your needs together. If all your care needs are measured as no need or low need, this shows that you are not eligible for CHC. However, if your care needs include one priority or two or more severe weightings, then you are very likely to be eligible for CHC. If your matrix shows a mix of different weightings, you may still be eligible for CHC because we also consider the nature, intensity, complexity, and unpredictability of your needs. Nature. This describes what your needs are like and the effect they have on you, including the type of support or treatment that works best to manage those needs. Intensity. This describes how much, like how often, and how severe your needs are. It also describes the support needed to help you, including the need for ongoing care. Complexity. This is about how your needs affect each other, like if one of your needs makes another need change or get worse and become difficult to manage. It also describes the level of skill needed to check your symptoms, treat the condition, and/or manage your care. Unpredictability. This is about how much and how often your needs can change and what the challenges are for the people who give you care and support. It should also explain the risk to your health if the right care is not given at the right time. Someone with an unpredictable healthcare need is likely to have a changeable and unstable condition or a quickly deteriorating condition. The Decision Support Tool helps health and social care workers identify and describe your needs. With this knowledge and their skills and professional judgment, they work out if you have a primary health need and if they think you are eligible for CHC. This is called their recommendation. When the Care Needs Assessment and Decision Support Tool are complete, you need to check if you agree with what has been written about you. The multidisciplinary team can give you a copy of all the forms and documents that have been written. The documents and the recommendation are also shared with the CCG, and the CCG decides if they agree with the recommendation. The CCG usually agree with the recommendation from the multidisciplinary team, unless there are very strong reasons why they can't. You will then get a letter from the CCG saying whether you are eligible for CHC. If you are not eligible, the CCG should explain why. If the CCG decides you should not have CHC, you can ask them to think again about their decision. And if you're still unhappy with the CCG decision, You can then ask for an independent review from NHS England. If you aren't eligible for CHC, the NHS may still have a responsibility to provide you with care and support to help you manage your health needs, like by commissioning services or paying for some of your help and support. Care that is commissioned or paid for by a local authority and a CCG is called joint funding or a joint package. If your care is paid for by the CCG and the local authority together, you may have to pay a contribution or part of the cost for your social care. The CCG will not charge you for the NHS care you need. If you're not eligible for joint funding, you may be eligible for support from your local authority.